so we're going to go through some movement assessment tests. We're going to start with the hip extension movement assessment. This is Doug, he's my model today. What we're going to do is have him set up on a platform with his heels hanging off the end. What I'm going to ask him to do is actually take his hands, place them by his sides, right, and palms up, and just rest his head in as comfortable of a position as he can. Okay? So what we're testing here is the ability of the hip to extend, which is very functional when we look at gait patterns. So what I'm going to ask Doug to do is just begin by lifting his left leg up just slightly above the height of his rear end, and then place it back down. Good. And then I'm just going to get him to do the other side. Beautiful. And then back to the first side again. Good. And the second side. Good job. And one more time each side, Doug. Terrific. Good. And just take a little rest. So what we're looking for here, ideally, is that we get an activation of the gluteal on the same side as the leg lift, with contraction of the contralateral erector spinae in order to initiate the movement. Right? And then activation of the hamstring is fine to initiate as well. But what we're looking to avoid is activation on the same side of erector spinae or any movement through the low back. Okay? I'm going to get him to actually roll onto his side now, and we're going to do a hip abduction movement assessment. So if you wouldn't mind rolling onto your side facing the camera. Beautiful. We're going to get the bottom leg to bend, so we'll just get you to flex that front foot. Just relax it just a little bit. There we go. Perfect. Okay. So Doug is lying on his side. Right, and again, head resting as comfortably as possible. What I'm going to ask him to do again is just lift the top leg up probably about 20 degrees. So we'll get you to lift the leg up. And then back down again. Good, and then do it again. Good, and then one more time. Terrific. So again, what we're looking for here is that there is no flexion in through the hip, so that we've got good activation of the glute medius and the glute minimus, as well as the abductors of the legs. The other thing we were looking for too is that the QL remains as a stabilizer and doesn't become a prime mover in the movement. So if Doug were to have shown a bit of a hip hike or a hip drop, then that would have shown more activation of the QL as a mover versus a stabilizer. And again, we want activation through the side of the hip and the TFL in order to activate that. Now one more assessment that we're going to do with Doug, I'm going to get him to sit up and actually swing his legs towards the back, so towards me, so his back is facing the camera. And the third test we're going to do is shoulder abduction. Okay. So what I'm going to have him do is start with his elbows by his sides, and bend the elbows rather, just slightly flexed there, perfect. And then I'm going to ask him just to slowly lift his arms out to the side, just towards shoulder height, and then back down again. Good, and then just do that a couple more times. What we're looking for here is appropriate scapulohumeral rhythm. Maybe just one more time, Doug. Terrific. So what we're looking for is that we've got correct initiation of the glenohumeral joint, right? So the scapula elevates and comes in conjunction with the rotator cuff, the levator scapula, and the trapezius all at once. If, for instance, he had actually elevated up through the trapezius first, before the arms hit about 60 degrees range of motion, that would have let us know that we're getting a little bit of overactivation here and maybe a little bit of underactivation through the center of the back, the mid-traps and the rhomboids. So those are our three assessments today, looking at hip extension, hip abduction, and shoulder abduction.